All right, we got some pretty interesting news out of Project Veritas that came out last night, I believe. So, they did an undercover reporting job on this guy named Jordan Tristan Walker, who works for Pfizer. He's their director of research and development for their strategic operations and mRNA scientific planning. Now, the gist of this all is that Pfizer, the company, is thinking about mutating COVID for the purpose of being able to learn how the virus mutates and use that knowledge to then develop vaccines faster, I guess. That from what this man has said, that would be the end goal of these kinds of experiments. Now, I think it's important to point out that right now, Pfizer is only thinking about doing this. They are very well aware of the potential for massive public backlash, which they're pretty much getting at this point because it's been exposed. But let's go ahead and get into it. So, as I already said, Project Veritas did a sting on this guy. It's kind of amazing that they can keep pulling off this kind of, I guess, almost like a Tinder style kind of date where this person thinks he's sitting down with someone who's interested and starts asking a bunch of questions about the company, and this person just starts spilling a lot of beans. I mean, it's kind of incredible in a way. I mean, it's not like this guy's even the first Pfizer employee to have been stung by James O'Keefe in Project Veritas. At this point, I'd figure that like big companies like this that are surrounded with controversy would have meetings where they tell their employees, if you're ever out on a date with somebody you met on the internet and they're asking questions about the company and some of this looks like it might be controversial, why don't you just go ahead and, I don't know, not talk about the internal operations of the company? It could be an undercover reporter. But, apparently these people are, I guess, willing to speak the truth when they think that no one's really watching or when it might make them look like someone who's intelligent or somehow important to the operations of the company itself. But anyhow, according to this guy, as I've already said, point of mutating COVID is to learn how COVID mutates. The results of this research would then be used to make new vaccines for new COVID variants that emerge in the wild. They kind of joke a little bit about how it's a business model or a potential business model, and they even refer to it as a cash cow. I mean, pharmaceutical companies are supposed to make money off of providing medicine. Duh. That's like the entire point of their existence. But then it gets more controversial when you look into all the mandates that are around the COVID vaccines, and yeah, it's going to cause a lot of people to be upset that you're making money off of these government edicts, and then you look at the amount of money that we know Pfizer spends on advertisements, and the political donations that big companies like this make, and a lot of people are worried about potential corruption. But we'll get more into potential corruption a little bit later. So the potential experiments that this guy, Jordan Tristan Walker, talked about, the basic idea would be you have a bunch of monkeys, you infect one with COVID, and then you take samples from that monkey that got COVID, and you look at the small mutations the virus went through. Then, say you want to make the virus a bit more transmissible, more virulent, you take the virus with the proteins that make it the most virulent, and you start infecting other monkeys with that. And then you do the same process with those other monkeys, where you just keep taking the most virulent strain, and you keep infecting more and more monkeys. It's essentially selective breeding. Like when you take a dog and you take wolves, for example, but you eventually breed them down into like small little chihuahuas. It's the same basic concept. You have a sort of stock wild version, which is whatever variant of COVID they harvested from the environment, and then you take the replicated COVID. I mean, obviously, infects a host. It replicates itself in the host cells. You take those replicated versions, which have small mutations or small changes, and you keep breeding the change that you want to make that change more pronounced over time. And so essentially, yeah, you get wolf, you turn it into a Chihuahua or a German Shepherd, or you turn it into a Doberman. But basically, you just keep selectively breeding it for a quality that you may or may not want. Now, Pfizer's goal in all this would be to study the changes, figure out how the changes occur, and then when you understand those better, that knowledge can help you develop vaccines faster. I mean, on the surface, vaccines are a good thing, get sick or you'd like to not get sick, vaccine can save your life. But when you look at the COVID stuff, when you look at the controversy related to the mandates, people question whether or not this vaccine is actually helping you. I mean, you look at the whole Damar Hamlin story, you look at documentaries like Died Suddenly. I mean, none of these things are perfect. That's not to say that you can't just go out and blame COVID vaccines for this thing. I think it's also fair to point out that just about everybody who got a COVID vaccine probably also got COVID. So, I mean, it's what is causing all these weird instances where people, young men in particular, seem to die for strange and arbitrary reasons or have these strange heart problems. It's kind of hard to really explain. But a lot of people are worried that it's the COVID vaccine. They could be right, but again, you need time, you need lots of experiments and trying to figure that out. But seeing as would literally be Pfizer creating new COVID variants, I mean, people would be upset about that. I mean, I recall a few months ago there was a whole study going on about how I think it was Stanford maybe, or I don't know, some big name university I think decided they took so the alpha strain of COVID, and which is the most deadly strain, and they put the Omicron spike proteins or the Omicron proteins on its surface. So it's essentially a combination of the most lethal COVID along with the most infectious COVID. And that's essentially the kind of thing that they can do here. Now, there's also the whole other issue related to gain of function research. This stuff is not supposed to occur. There are rules against funding it or allowing it in the US. I mean, it seems kind of strange to make this distinction where this is essentially selective breeding of a virus. It's artificial selection, and you're trying to get a new quality out of that virus. As to whether or not that translates into the virus having a new function can be argued, I guess. I mean, I don't know. It seems like a semantic excuse to pursue gain of function, if you'd ask me, because essentially you are breeding of the virus to be different than what it originally was. I mean, so say you wanted to hypothetically breed it to be a bit more virulent, more infectious. Does more infectivity count as a new function? Or is it just an enhanced function? I honestly, I'm not familiar enough with the rules and the nuances in order to say. But personally, I feel like it's pushing the ethical boundaries. Some people are upset about, I mean, I've seen some people get upset about like how you're testing this on monkeys. I don't know. COVID's a pretty mild disease. There are certainly worse ones. It's not Ebola. It's pretty survivable. So if you want to try and study it by infecting monkeys, I really don't see the problem with animal testing in this case. If you start infecting monkeys with Ebola, I think have a few more concerns, but like that's kind of sadistic, and I'm not sure if that's a good idea. All that being said, it's important to keep in mind that Pfizer, there's no evidence to suggest that Pfizer is currently doing this. This is just something that they're considering, that they're thinking about. And Pfizer is very well aware of the potential public backlash. I mean, it's kind of obvious that after you had, I mean, this guy even admits that the COVID probably came from the Wuhan lab. Lab leak theory makes a whole lot more sense than the theory that somehow this came from some wet market in the city of Wuhan. So, I mean, yeah, there's that. If a mutated strain got out, Pfizer would be on the hook. That'd be horrible. Any other pharmaceutical company who could be considering the same thing would probably go through the same considerations. They're probably thinking, oh my God, I don't want this to get out if we ever try to go down this route. They probably even feel bad enough that it gets publicly leaked because that just makes them look like they could be Bond villains, I guess. But, I mean, I don't know. I think experimentation is fine so long as it's done under a controlled context. I still think it's highly dangerous. The only way I'd be like not worried is if they do it on some sort of like private island where researchers like go and spend 2 weeks there, but you spend about a week afterwards just making sure that you don't have any sort of disease from that place after you leave. But that's probably not what they're going to be doing. So, I mean, I would be a little bit worried, not that worried, but still though, there's that dangerous potential of these kinds of things getting out into the world. And then there's a semantic game over whether it's gain of function or not gain of function. I don't know. It's apples and pears. It's like, yeah, they're kind of similar in a way. Actually, that's not quite the same. They're still the same species. How about oranges and lemons? They're both citrus. There. I guess that's something of a better terrible comparison. But yeah, so far they're not doing it, and the determining factor is whether or not they will do it, according to this employee, seems to be whether or not it seems to depend on the results of some ongoing experiments. This video doesn't really make clear what those experiments are, but I would be a little bit concerned about what they are. I mean, is it related to this? I'd assume maybe they're testing the what's the word for it? The mutation capacity for COVID in some way, so they could figure out whether or not this is worth their time. I mean, if you keep breeding monkeys, or if you keep breeding the virus in monkeys and it's not mutating that fast, is it a waste of your time? Yeah, it could be. So my guess is that these ongoing experiments will probably reveal to them under what conditions it might mutate and how you could try to control for mutations or something like that. So it could very well be that they're intending to do this. They're just in the process of trying to figure out how to go about it. So yeah, there's that, which is kind of concerning. And he admits that COVID came from the Wuhan Institute of Virology, or he thinks it does. I would believe that. I mean, it just doesn't seem reasonable to me that you have a wet market and a biolab within a mile apart of ground zero. They're both within ground zero of where this novel coronavirus came from. If I had to take a guess as to which one it was, I'd say it's probably the biolab. That would be my guess. But no, he also goes on to also admit how there's a huge turnover in the careers of public officials and people who work at Pfizer. That's concerning. I mean, in an ideal world, the regulatory agency would be able to limit the capacity of companies like Pfizer to engage in dangerous research. But when the same people go back and forth between these organizations, the public regulatory side and the private pharmaceutical side, well, it makes you kind of wonder. I mean, you have friends on both sides of the aisle, so that kind of compromises your integrity. I mean, if you were having a court case and you had to select a jury, would you pick, and say there's a murder trial going on, and one of the people on the guy on trial has a relative in the jury? Is that okay? Not really. That person would be removed from the jury because of bias. In a kind of similar way, I'd say that if you work at a regulatory agency or if you work for a private pharmaceutical company, there should be some sort of limitation as to being able to go back and forth in your career. But this guy talks about it like it's a fairly common thing. So yeah. And I think it's also worth getting into whether or not this guy is legit. I think he is, or I would assume he is. But James OKeefe has tweeted out some internal documents that he's obtained saying that this guy is the right guy. He is who he says he is. So we'll just flip through those real quick. This looks like some sort of internal web portal for, I guess, a resume almost, or whatever this guy does in Pfizer. Works in New York, I guess. So yeah, Jordan Walker, Director, Research and Development of Strategic Operations and mRNA Scientific Planning. Seems like he's involved with this stuff. Then we have what looks like some sort of internal communications. There it is, Jordan Walker again. Director of Scientific Operations. Yeah, more internal communications. So if you ask me, I think this is the guy. I don't think that Project Veritas is making this up. Looks like this is probably the right one. But no, that's about all I have for today. Feel free to like and subscribe. Share your thoughts in the comments. Have a good day. Bye.